Welcome everyone to Ergonomics for Your Health. My name is Syra. I'm an intern in community education and outreach here at HSS. So today we'll be hearing about the role of ergonomics in promoting orthopedic health. So I'm very pleased to introduce our speaker today, Kelsey Rosen. She is an acute care orthopedic physical therapist, co-chair of the Safe Patient Handling Committee and Employee Safety Team Coordinator at Hospital for Special Surgery. She has certifications in selective functional movement assessment level 1 and as an ergonomics evaluation specialist. Her passion lies in employee and patient health, safety, and wellness. She is committed to safety and wellness for all. So pleased to hand it off to Kelsey Rosen.
Thank you, and thanks for having me. Good afternoon, everyone. My name is Kelsey Rosen, and I'm here to talk to you about ergonomics for your health. When we think about ergonomics, we generally think of adjusting our workstation, but in the broader spectrum, proper ergonomics criteria can be applied at work and within your home and hobby life. Whether you're commuting, working, relaxing, your day-to-day activities and posture can often cause stress on your body over time. So I'm here to discuss simple ways for you to change the way you work and move within your environment in order to better support overall mobility and comfort while reducing your risk of injury. It's important to note, and I will repeat this later, that everyone is individual and may have different conditions, and while some of what I state may be ideal, it may not work for all and may require more individualized ergonomic considerations. So first, I'd like to get to know the audience a little bit better, so you will soon see some polling questions. And I'll give us a couple, maybe a minute or two to fill this out. All right, and we still have some results coming in. Great, and now we're going to post some of those results. So for how many hours do you spend sitting each day? It looks like we have most people saying 4 to 6 hours, but the answers were all over the board. How often do you take a break to move around and relax? Varies every 1 hour, every 2 or more hours. A lot of people say it depends. Thankfully, people do take a break. Only 5% said I don't take a break. Have you set up your workspace with an eye to ergonomics? Again, varied results, yes, no, some people are uncertain. And have you thought about ergonomics at home? It's really awesome to see that about 55% of people said yes, and then 23% said no or uncertain. So this is great because hopefully I can provide you with some more information about ergonomics, but it seems like there are some people in the audience who generally have some passion or have taken some steps to look at their ergonomic space. So for my objectives today, we're going to define ergonomics and its importance. I'm going to explain posture. We'll review ideal postures in different positions, discuss ergonomics at work and within the office, discuss ergonomics while working at home, review everyday ergonomics, home and hobby, such as using your phone and driving, and then I'll provide you with some tips and takeaways. Well, what is ergonomics? Ergonomics is defined as an applied science concerned with designing and arranging things people use so that the people and things interact most efficiently and safely. Ergonomics provides essential guidelines on preventing illness and injury, allowing for individuals to avoid issues such as repetitive strain and discomfort. Some of the most common injuries surrounding improper ergonomics include pain in the hands, wrists, shoulders, neck, back, and eyes. I first became intrigued with ergonomics when my mom had multiple back surgeries. She was a radiologist who sat in a small, dark office looking at computer screens all day. Part of me wonders what changes we could have made to make her more comfortable and to prevent her aches and strains. So what now? It's 2022. Another story I have for you. My husband is now working from home, and as a PT, it was hard for me to watch him sit awkwardly for hours staring at a tiny laptop. We turned our dining room table into an office space for him because I could not bear to watch him try to work and sitting for prolonged periods of time in terrible posture. That is where ergonomics comes in, and you can really see the value in making changes. Your desk or your space is not really built for you. It's for anyone. So spending 8 hours a day reaching, slouching, or craning can lead to pain. Again, we're not Gumby and we can't really stretch ourselves out to fit. So that's why it's important to note, and I'm going to reiterate this a couple of times, that it's Ergonomics is making the environment fit to you rather than making you fit to the environment. We're all different shapes and sizes, and one design might not work for one person, and that may work for one person that doesn't necessarily work for another person. So why do we care? This post-pandemic era and working from home has forced us to rely on technology. These unprecedented times have led to more people than ever sitting in front of a screen for long hours. So besides just our working from home, we have more time watching TV, streaming shows, socializing on Zoom and FaceTime, virtual meetings versus in-person meetings. So maybe you can relate to my husband's story for working from home, but we also have other reasons why ergonomic design is important. And so over time, the body becomes stressed by these awkward postures or repeated movements, and the musculoskeletal system is affected. So you can avoid physical problems and improve your well-being, which is why we're here today. So what is posture? Posture is the body's alignment and positioning with respect to gravity. Over time, long-term poor posture can lead to musculoskeletal bones and muscle changes based on the stress from gravity. Some signs of some postural issues could include tension headaches, eye strain, neck and back pain. These were just some of the symptoms that my husband was expressing when he was sitting on his couch staring at a tiny screen in a hunched over posture. Pain, soreness, and stiffness throughout the body can affect daily functioning. So risks of poor posture. The three main curves of a properly aligned spine form an S shape. Over time, poor posture can cause these natural curves to change shape, putting an excessive amount of pressure in the wrong position. Our spines are built to absorb shock, but bad posture can slowly deteriorate this natural ability, putting your body at risk for more serious injury in the future. One of the most commonly known side effects of poor posture is unwanted strain on your upper and lower back. Slouching forward puts pressure between your shoulder blades and causes you to flatten your back muscles. If you notice pain below the neck and around your tailbone after a long day at work, you are likely not sitting up straight. Poor posture puts pressure on your posterior muscles, which has a negative impact on your neck. Whether your shoulders are hunched forwards or your head is aimed downwards, the strain put on your neck by the tightness of these muscles can lead to tension headaches. Deficient posture can put your entire system of muscles in a compromising position. If you are unable to fully relax your body at night, you may find yourself tossing and turning to find a comfortable position for your neck and back, which can lead to hours of lost sleep. If you have an office job that requires you to stay at a desk most of the day, sitting with bad posture can lead to digestive issues. Neglecting to pay attention to your posture can compress your organs, which can slow the digestive process and cause stomach issues. When you do not sit up straight or stand with your shoulders back, it can also have a negative impact on your work ethic. Your focus will be on feeling uncomfortable rather than the task at hand. Bad posture is also correlated to low self-esteem per health psychology. So if you look at this picture, here are some risks of poor posture. We have weakening of the deep knee flexors or the deep neck flexors, weakening of the lower trapezius and serrator anterior, and we have the tight pec muscles and tight upper trap and levator scapula. And lower body, we have tight erector spinae, or those back muscles, tight iliopsoas, which are your hip flexor muscles. Our abdominals tend to get weak, and our glutes tend to get weak. So prolonged positioning for extended periods of time can lead to tight muscles and weaken some very important muscles. That is why we're going to talk about the importance of setting up your space to suit you, but to also balance that with movement, which we will discuss further. So try to remember this slide. So what I have here is ideal sitting posture. Ideally, we want our feet flat on the floor. We can use a lumbar roll at our lower back if needed for more lumbar support. Our shoulder blades pulled back and our head back or in a neutral posture. Next, we have ideal standing posture. Our feet are hip width apart, knees over ankles. You don't want those legs hyperextended or pushed back. Our pelvis is neutral, our shoulder blades are back, and our head is back or in a neutral posture. Sleeping. So sleeping is it's something I'm pretty passionate about. I personally feel like Goldilocks. I'm just trying to find that right pillow for comfort. For side lying, we want a pillow between our knees. That's going to help keep our pelvis in a nice neutral position. or a pillow to support the head and the neck. We want to kind of fill that space. So you don't want a pillow that's too soft, that's going to bring your neck down, and you don't want a pillow that's too firm, that's going to push your neck up. So similar to the side when you're sleeping on your back, pillow underneath the knees, that's going to help relieve your lower back, and a pillow to support your head and your neck, same thing. We don't want something super, super soft where we're going to sink in. We don't want something super firm that's going to push us further into more cervical extension. So every individual is unique with a unique body type. I think I've stressed this quite a bit. An ergonomic workspace is tailored to your individual needs to prevent poor posture and physical strain. Over time, poor posture at work can impact our muscles, ligaments, joints, and spine. What I have here is a demonstration of what it would look like ideally when working at a desk at your job. The top of the monitor is at the eye level or just below. The monitor is roughly arm's length away. The feet are flat on the floor or resting on a footrest. The front of the seat is not pressing on the knees. The backrest is supporting his lower back. So I'm going to go over steps on how you can easily remember this, but this is an ideal sitting position at your desk. Now, I didn't mention that he has a document holder. So if you're someone that tends to look down and type at the same time, they do make specific document holders that can fit to your screen. So that way you're just moving your eyes and then you can type at the same time instead of doing neck flexion and looking down while you type, down and up and moving your neck all the time. So if you're a little overwhelmed by the previous slide, there are 5 simple steps you can remember when thinking about your ergonomic plan. You might say, hey, there's only 4 here, but we'll get to number 5. So the first one is your chair. You want to make sure you're sitting back comfortably in your chair. So a lot of us sit kind of perched forwards on our chair, or we just so we can get our feet flat on the floor. But a lot of our chairs have built-in back and lumbar support. So you want to scoot all the way back into your chair. You might say, hey, Kelsey, well, then my feet are dangling, and that's okay. That's when a footstool would come in. And we definitely want to make sure we're adjusting the height of the chair so our knees aren't up against our desk, and that we're sitting closer to the screen. So then the second one is the monitor the screen. You want to adjust the height. So you want to make sure your eyes, when you're looking at the screen, is going to be pointing at the top of the monitor. You can use a laser pointer to measure that. The distance, so ideally we want arm's length away, arm's distance. So if you were sitting as close to your desk as you can and you put your arm straight out, you would push your screen back or bring it in closer, about arm's length. And then if you use a laptop, you should consider a kickstand. The third step is minding your mouse and your keyboard. So we want all of our keyboard and our mouse within our reach. So for example, if you're using your mouse, you want to make sure you're moving more from the wrist and less from the shoulder. If your mouse is out too far, you're going to start moving your shoulder and you're going to get some discomfort in your shoulder. And then number 4 is your phone. So we want to make sure our phone is on our non-writing side. That way, if you do some typing, so for example, it would be my left side, I would type with my right hand. If I had my phone on this side and I was typing, I would tend to cradle the phone between my neck and my shoulder, and that would cause strain on my neck over time. And then finally, you should consider a headset if you do use the phone a lot, because it makes it a lot easier. So movement. Take breaks, make small movements every 15 minutes. Get up every hour, set a timer on your phone if you need to take those micro breaks, okay? The second one is stay strong. So we're gonna go over some strengthening exercises. We'll go over some stretching exercises. And so the third one is stretch daily, prevent muscle tension. So if you remember the previous slide with the tight and weak muscles, when thinking about a plan for strengthening and stretching, we wanna stretch those muscles that have gotten tight, those pectorals, those shoulder upper traps, those hip flexors, and strengthen those muscles that have become weakened or lengthened from poor posture, those abdominals, those buttocks muscles, those scapular muscles. So if you're thinking that you have a lot of tension in one area, you want to stretch that area, you want to lengthen, you're thinking you're getting weaker in a certain area, those are the ones we want to strengthen. So here are some simple stretches or exercises you can do while seated. The first one is called a chin tuck. So before I go over that, after about 10 or 15 minutes, we tend to slouch in our chair. So these basic exercises are those small little movements we can do every so often. So the first one is a chin tuck. So you basically, so instead of coming forwards like this, we're taking our chin and we're pushing it back, okay? Almost like we're making a double chin. As you do that, you hold it for 5 seconds and you should feel some stretching in your cervical spine, okay? That's gonna lengthen the cervical spine and add more space between your vertebral spaces and open that up. The second one is a neck side bend. So you can either do this just by bringing your ear to your shoulder, okay? And if you wanted a little bit more tension, you can just add your hand and just kind of guide your ear to your shoulder on each side. About a 10-second hold. And then finally, we have some shoulder blade squeezes. So if you think about holding the soda can between your shoulder blades, you're gonna take that soda can, you're gonna squeeze it between your shoulder blades, and you're gonna do a 5-second hold. Okay, this is more of a strengthening one. So this is tightening up those weakened muscles that have become lengthened by sitting in a slouched or forward posture. So here are a few additional exercises you can do. Personally, I think the forearm and the wrist is a great addition if you type a lot or you use tools while you work. So you're basically going to go into extension here, and then you can do a little bit of adding some tension here, okay, to stretch those muscles that get tight when we type or we use fine tools. So these are 2 exercises. So we talked about how those abdominal muscles can get weak from sitting for extendedly long periods of time. Those glutes can get weak. So the first one, if you want to follow along, we can do this just in sitting. You place your hands on your abdomen next to your hip bones. This is where you're going to feel your transverse abdominis muscles turn on. So if you put your hands on your hips, these 2 fingers in the front is where you're going to feel those muscles start to activate. You're going to draw your belly button toward your spine and tighten the muscle under your fingers. Do not hold your breath or suck in. Keep breathing normally while you hold this contraction. You're going to feel your pelvis achieve a neutral alignment. The second one is a gluteus engagement, so a glute activation. So basically what you're going to do, and this is what I tell my patients, pretend you have money between those cheeks, right? You want to squeeze your gluteus muscles together and hold that for about 5 seconds. You don't want to let go. So a gentle glute activation, 5-second hold, and then let go. And those are 2 simple exercises you can do even just sitting in your chair. So these are some equipment considerations. We talked about that document holder that allows you to position the paperwork at a height, angle, and position on your desk to ensure posture when reading. When referencing documents, the majority of us place our paperwork flat on the desk, which requires downward viewing angle. So that document holder would just kind of help you so you're not doing so much neck movement. Another one is a seat wedge cushion for extra support on your buttocks. We have wrist pads, which help reduce strain and pinching on the hand and arm muscles by providing support. It helps hold the hand and wrist in proper neutral position for efficient muscle movement. I just want to mention that we should be careful with this. We want our wrist in a neutral position because sometimes if we have too much cushion or too much contact stress on that wrist, that could lead to some tingling in the hands or something called carpal tunnel where you're compressing that median nerve. So again, we just want to make sure we achieve this nice neutral wrist posture. Foot rests, so the feet are resting comfortable. Be creative. I'm currently using 2 reams of paper to get my feet flat on the floor at my desk. And then a lumbar support, which improves your posture, reducing the stress on your muscles. So it's great if you need more from your chair. So we talked about ergonomics within your office environment or your workspace. That was the first one. And we're also going to talk about ergonomics at home, at your table, sitting in a reclining chair or sofa, at your kitchen counter, or even in bed. So just for this purpose, we're going to call this lady Sally. And Sally is working at a table, similar to how my husband was. She uses a raised laptop stand or some other stable platform. We didn't have that, so we used books, we used reams of paper, anything we could to raise the height of that laptop. She's using a separate keyboard and mouse, so then now that her keyboard is raised, she's not typing up here. She has a separate keyboard. She's placed a pillow on the seat to raise to the appropriate height so that her knees are slightly slope down compared to her hips. We don't want those knees above the hips. That's going to put more strain on those already tight hip flexor muscles. The front of the seat should not be pressing on the knees, so comfortable height, and feet flat on the ground. So she's also using, looks like could be a shoebox, looks like reams of paper, but something so that her feet are resting comfortably on the floor. So be creative as much as you can. So next is working in a chair or on a sofa. For a sofa, couches and sofas can be soft and squishy. Ideally, you want to position yourself supported. These postures should not only be considered when on a laptop, but also while you're watching a TV or using an iPad. So she has a pillow behind her back so that she doesn't slouch back into that soft cushion. So place a pillow behind your back to maintain that upright posture. Use a separate mouse. Use a lap desk if you can to elevate the computer to a comfortable height. Again, you can use books, you can get creative, and prop the feet up on a stable object such as a footstool. Feet flat on the floor. So working at a kitchen counter. So here I do want to mention, so this is talking about ergonomics at home. We have someone sitting at a table, but it's also important to make sure we alternate between sitting and standing during the day. So this is great if you shift from that table setting or that couch setting to now standing up. So we want to avoid neck strain by looking down with your eyes at the monitor instead of looking with your neck to prevent all of that neck flexion during the day. You want to raise your laptop using a stand or some other stable platform. We talked about those reams of paper, so there you see it here. The wrist straight, your hands at or below elbow level. So either 90-90, or this is probably, you know, he has a 30-degree elbow flexion. This is okay here because he's not punched up in his shoulders or not putting too much contact stress on his forearm. And then he's standing on an anti-fatigue mat. If you don't have an anti-fatigue mat or you don't want to buy one, you can consider a stool. You can put one foot up, so your right foot up on that stool about 15 minutes, and that'll allow you to just shift your weight a little bit and then alternate. Everything is about alternating and moving. So we don't want those prolonged postures that cause tension. So right leg up, about 15 minutes, then you can move that stool over and put your left leg up just to allow your body to shift weight. And finally, working in bed. So if you can avoid it, try to avoid it. Beds tend to seem squishy, but people do it and that's fine. She has a pillow underneath her knees to help keep her low back supported. And she also has a firm pillow behind her back to prop herself up so that her feet and her body is in a comfortable position sitting upright. You want to avoid neck strain by looking down with your eyes at the monitor. So because her screen is low, instead of bending from the neck, she's going to try to look down as much as she can at her monitor. So some tips and takeaways. Change your position. Take a break if you have a sedentary job, or even if you don't. Alternate between sitting and standing at your desk. Stand up to make a phone call or lean back in your chair. A lot of our chairs, our office chairs, have the ability to recline back, so lean back if you can. Or you can do one of the exercises that I had listed where you lean back and you support your neck with your hands, and that's going to give you a nice stretch. Move around during the day if you can. So take the stairs rather than the elevator, or go see people instead of sending an email or making a phone call. I tell people if you print something, you know, get up, go to that printer, just move. And get creative. Use shoe boxes if you're at home, cushions, towels, books, reams of paper. And then finally, a plug here is drink water and eat snacks. So I have a picture here of, and I currently have mine with me here, is a time-based water bottle. So I wanted to stay hydrated. And one of my wellness goals was to make sure I was drinking more water. And I don't like water. I couldn't drink water. I added lemon to my water to get myself to drink more water. But the time-based water bottles kind of keep me on track. And the reason I'm bringing this up is this almost like a forced way to get up to go to the bathroom. So it's a bodily response that kind of forces me to get up and go use the bathroom and take a break. So this is not only is this a plug for wellness so that you can hydrate a little bit more, but also another reason to get up and move. So we talked about ergonomics in the office. We talked about work ergonomics at home, or general using your iPad, watching TV. But now we're going to talk about everyday ergonomics. So staying healthy includes making sure that the daily pressures do not result in physical stresses. When we're not at work or on the computer, we tend to turn to our technology, such as our phones. I don't know if you can relate to this, but if you're typing at work on your computer, the next thing you do is you turn and you go to pick up your phone. So I don't know if you've heard of something called text neck. So that's when our neck tends to fall forwards over time because we're constantly looking down at our phones, texting our friends and family. And then sometimes we have sore thumbs, tired wrists, and aching necks. And some people even use their phones or iPads, things like that, for their work. So we went from doing it, or even if you're commuting, you're doing an office job and you go from your computer desk and then you go sit on the train or the bus and then you're looking down at your phone. So I have a couple of tips on how we should be using our phones. So there are a couple of tips on how to hold your phone to prevent physical stressors. You're going to start with your arms down by your side, keep your elbows close to your body, bend your elbows and bring your forearms up towards you. Position yourself where you can look directly ahead at your phone and look around the screen using your eyes. The joints in our thumbs are not designed for constantly scrolling and typing. Your index fingers can do the job more efficiently. Also, try to be conscious of how hard you are pressing on the screens here. You want to type gently. Some people just kind of like push really hard. You want a gentle type. Allow your phone to rest in one hand while you use it with the other. This will allow you to hold your phone with less tension. So also try to alternate between your hands. And since we're talking about wellness, or since I brought up wellness and prevention, this is a great plug for mindfulness practice. So wait to take that phone call, put your phone down and be where your feet are. Observe your surroundings and consider this time that you are outdoors, your scheduled self-time. Not only will this prevent balance issues and falls, but it can also be considered time for self-reflection and meditation. In New York City, there are many obstacles here. There's loud noise, New York City drivers, rough terrain. It is of the utmost importance for your safety to look where you're going. So although I said to bring your phone up and look at your phone, you may want to take this moment, maybe put your phone down for a minute, absorb your surroundings, and then pick that phone back up when you don't have as many distractions around, such as sitting on that train, that bus, things like that. So some other tips and reminders for your handheld devices: setting a reminder or use an app. So if you can see this image, if not, I'll explain it. For the 20-20-20 rule is for every 20 minutes that you're looking at the screen, you should look 20 feet away for about 20 seconds. Okay, so for every 20 minutes you're looking at the screen, you should look 20 feet away for 20 seconds. Also consider headphones to minimize distraction. Use device digital assistants. I started using my mic. I didn't know that my phone could type for me, so I started using my voice activated typing to send messages when I'm outside trying to send a quick message to family or friends. And adjust your device settings to avoid eye strain. So there's the ability to adjust your brightness on your phone or adjust the text, make the size big, bold, use the magnifier camera tool, many options. You don't want to be straining looking down at your phone, straining those eyes. So we talked about using your phone, and now I have some tips for driving. So set your headrest. Set the top of your headrest between the top of your ears and the top of your head. It should just touch the back of your head when you're sitting comfortably. The headrest is also important in reducing whiplash injuries in the event of a rear-end collision. So it's important, in fact, that standards were developed for it. Support your back. Slide your tailbone as close to the back seat as possible. Same thing we just said about that, using the chair, sitting back in your chair as much as you can. Aim for a 2 to 3 finger gap between the back of your knees and the front of your seat area. If your vehicle doesn't allow for proper position, a lumbar or back cushion may help. Use a lumbar support. If your car is adjustable lumbar support, set it using both the front, back, and up-down controls, so you feel an even pressure from your hips to your shoulders. If your car doesn't have automatic support, a lumbar pillow or even a rolled up towel can help. Lift your hips. If you can, adjust your seat pan, the part you sit on, so that your thighs are supported along the entire length, and your knees are slightly lower than your hips. This will increase circulation to your back while opening up your hips more. Don't sit too close. You should be able to comfortably reach the pedals and press them through their full range with your entire foot. Safety is also a consideration here. This study suggested that drivers whose chests were close to the wheel were significantly more likely to suffer severe injuries to the head, neck, and chest in front. Get the right height. Make sure your seat raises your eye level at least 3 inches above the steering wheel while allowing sufficient clearance between your head and the roof. Lean back a little. The angle of your seat back should be greater than perpendicular 90 degrees. At 100 to 110 degrees, the seat will put the least pressure on your back. Leaning too far back forces you to push your head and neck forward, which can cause neck and shoulder pain and tingling in your fingers. Another tip is to adjust your monitors. I know I don't have that on here, or adjust your mirrors. I know I don't have that on here, but I think it's a really good point. So prevent neck strain by making sure your rear view and side view mirrors are properly adjusted. You should be able to see the traffic behind you without having to crane your neck. So you shouldn't be craning your neck to look at traffic. Getting into and out of the car is important. You want to avoid twisting as much as you can. It's just good spine health. So don't twist. Turn your torso so your feet stay in line with your hips. And then finally, for people that drive long distances, I like to say every hour, try to get out of the car. Even when you're perfectly situated in that driver's seat, fatigue will inevitably set in, especially when you're driving for long periods. So listen to your body and take periodic breaks. Park safely at a rest stop or other designated stopping area to get out of your car and do some of those stretches we went over. So in conclusion, proper ergonomics is important, not just at work, but within our daily lives. Proper posture decreases stress on bones and joints. Flexibility, strengthening, and knowing your alignment are the keys to maintaining good posture. Set your home space and workstation up for success. Again, it is individual to you. Keep moving, alternate between sitting, standing, and walking. Thank you, and I'll take any questions.
Thank you so much, Kelsey. So we'll move into some Q&A. So for our first question, we had a participant ask, which exercises should I do or not do with frozen shoulder?
So frozen shoulder is a very individualized diagnosis. So I am happy to go over some of that specifically offline. You should, if you have frozen shoulder, hopefully you have a PT that you're working with. So you can bring this up to them and hopefully they will have some good recommendations for you within your home environment.
Okay, great. Thank you. And now another person asks if you could explain a little bit more about neutral wrist posture.
Great, absolutely. So neutral wrist posture is your wrist in this flat plane. So sometimes if our keyboard is too high, we tend to be typing like this, and that's wrist extension. And that's going to put contact stress here, which can lead to tingling in the hands or compression on that median nerve or some kind of nerve stress. If our wrist is down here in this flexion posture, again, that's not neutral. That's going to cause excessive muscle strain. So neutral wrist posture is just this flat plane here, where our fingers should just be able to do most of that typing.
Great, thank you. Okay, and we have another question about foot exercisers. So someone is asking, what about those foot exercisers that you can put under your desk? Is that something that you would recommend, or can you explain a little bit about that?
Yeah, absolutely. So I think what you mean by that is those bicycles, and that is totally up to you if that is something you want to do to get a little bit more cardio in. That's going to help you with blood flow and circulation. And if you can multitask, by all means, that's fine. But again, you're going to be sitting in a certain posture while you're moving your legs up and down. You want to make sure we're also getting those postural muscles that we talked about earlier if you're feeling any kind of sprains and strains. So while, cycling under your desk, I think that's where we're going with that, is great, and great cardiovascular fitness. We also want to make sure we're doing stretching and strengthening as well for those postural muscles.
Okay, amazing. Thank you. And we have another question, wondering if you have any suggestions for decreasing coccyx pain when sitting other than a cutout pillow.
So it seems like a lot of that pain is lower back. Our bodies tend to speak to one another. So your strain can really be also coming from your lower back as well. You may want to consider putting a rolled towel behind your back or some kind of lumbar support to kind of help shift your pelvis in a more neutral posture. It's really hard to tell if I can't see the rest of your ergonomics design, but if you're having a lot of pressure on that tailbone, it's making me feel that maybe your hips are rotated a little bit posteriorly. So I think adding that lumbar support will help kind of shift your pelvis in a more neutral posture, causing less strain on that coccyx bone.
Great, thank you. And now another question, where and how would you place the rolled up pillow in the car that you mentioned?
So that would be lumbar support, lower back, or if you're not the driver, if you're a passenger, I know some people have used it. Some cars don't have the option to move their headrest up and down. So we'll put something here to fill this space in the car for those long car drives. So something to just fill that space in your cervical spine to allow your neck to rest in a more neutral posture.
Great, thank you. And then we're going to wrap up with just one more question. Do you have any advice on how to look for a good physical therapist to help with posture and ergonomics?
Absolutely. I mean, we're at HSS, so HSS has if you go online, has a network, and you should be able to type in some of what's going on, and they're really good at connecting you with physical therapists. I'm super passionate about ergonomics. There's a bunch of my colleagues who are also passionate about it and specialize. Some of those performance physical therapists or performance and exercise physiologists are awesome. And if you don't have anything close to HSS in the city, in the main campus, HSS has expanded to Long Island, New Jersey, Connecticut. So take advantage of that online service and see if we can connect you with someone.
Okay, amazing. Well, thank you so much, Kelsey. That's all the time we have for today, but really appreciate you giving that very informative lecture to us all. And again, if anyone has any questions about upcoming programs, you can reach out to communityed@hss.edu. And this webinar was recorded and will be posted to our YouTube channel, so you'll be able to view it anytime at your convenience. Thank you, everyone, and thank you, Kelsey.
Thank you.